Welcome to the Fraum Center with our friend, Dr. H. It's so great to see you.
Thank you.
I tell you what, it's absolutely glorious outside, and seeing the sun puts us all in a pretty good mood, and spirits are high.
Yeah, it's really given us quite the taste for spring. I think everybody's looking forward to that for sure.
Absolutely. Well, coming in today, I was super excited because of the weather and because of we're feeling like we can get out now and be active after a few weeks of kind of hunkering down. One of the things I was thinking about, though, is being careful and being ready to be active.
Yes.
I know my husband's a big golfer, and he was like, oh my gosh, I'm ready to get out there. Okay, talk us through how we actually prepare to be healthy and happy as we get more active.
Absolutely. So, especially if people's primary method of exercise is outdoor focused, and then when the weather turns, they don't go outdoors. That, you know, depending on the year, that could be 3, 4, 5 months of inactivity. You never want to go from no exercise to 18 holes. Nothing good is going to come of that, right?
Which is hard for us. We tend to be all or nothing, and we get excited and we think, well, I did it last year.
Right, right. But, you know, if there's no other exercises in that time frame, that's a lot of muscle mass loss, that's a lot of balance issues, that's a lot of stiffness that has set in.
Okay.
So really, for starters, you know, people who are outdoor focused, if they can find an activity that they can do to help maintain those things during those winter months, that would be best. But if they don't, then we got to ease back into it. We can't go 0 to 60.
Well, and one of the things that was really interesting the last time we talked was about being proactive.
Yes.
And rather than waiting until I have an injury or I exacerbate an injury I have had, you were like, please just come in. Let's, please, you know, come in. Let's start where we can take you
Absolutely.
the spectrum.
Absolutely. Yeah, a lot of times people wait until their arm's like falling off.
Right.
You know, not really, but they
hear
feel
you.
like that. Their you know, spine is super stiff to the point that they can't move. But if they would come in before that point, when they know things are getting worse, we don't have to work as hard to get their mobility back to where they want it to be. So getting on it early means we have less work to do. Okay, but also, you know, looking at our bodies and saying, what do I need to do now to maintain the level of activity that I want to maintain? Unfortunately, you know, some of us realize this sooner than others. Tomorrow is never guaranteed.
No,
right?
That's true.
And how our body is functioning and how healthy we are is never guaranteed either. Right?
So let's talk about, I come in theoretically and I'm getting ready to play golf, and I'm maturing. And I come in and I say, I feel pretty good, but maybe my left hip, maybe my elbow's a little off. You know, I woke up with kind of my neck feeling odd, and I'm going to play golf tomorrow. Can you take me through, would you do an assessment? Are you listening to my symptoms and then designing sort of a treatment protocol? How does all this work?
Yeah, well, listening is number one, right? Because patients will tell me what's going on if I will just sit there and listen to them. That's the most important. You know, x-rays if needed, right? If, you know, something that a patient may not think is impacting their life very much, you know, when I'm watching them move through the office, it's much more pronounced and significant than they understand.
One of the things that you always tell me is sometimes you may come in with a symptom, but that might not be the problem. We are not going to Band-Aid it.
Correct. Yeah, you know, back stiffness is a great example of this, right? Or maybe I'm having hip and knee pain, and it turns out it's actually a pinched nerve coming from the low back, right? And unfortunately, most of us Americans want a quick fix.
Yes.
We want to feel better.
Or a pill.
Yeah, something that makes it go all the way away right now, so I don't have to worry about it again. And that's just not realistic. That's not how our bodies work. That's not a realistic form of therapy. Typically, when we have the dysfunction set in, especially as we age, we're going to have to put some time and effort into rehabbing that area of our body. But it will be so worth it by the time we've done it.
I love it. I mean, I can't say anything more to this. I mean, I think what you're saying is be wise, be proactive.
And value your body. It is the only one we have in this lifetime. So,
perfect.
Thanks.